Hi everyone, this video is sponsored by Chegg. Stick around later to learn more about the helpful science and medicine education that is offered within the Chegg study pack. This lesson is on the signs and symptoms of prostatitis or prostate inflammation. Before we get into the signs and symptoms, let's talk about what prostatitis is. Prostatitis is a urologic condition involving inflammation of the prostate. So prostatitis is inflammation of the prostate. How many people are actually affected with this condition? It actually is relatively a common condition. It may affect upwards of 10 to 12% of the male population, and oftentimes affects young men and older men. So there are two age groups that are often more likely to be affected. There are risk factors for actually having this condition. Some of them include anatomical structural abnormalities. These might include benign prostatic hyperplasia or an enlarged prostate. Urinary tract infections or UTIs is another risk factor. Having an indwelling catheter and being immunocompromised and having stress, which can also lead to immunosuppression. These increase the likelihood of having infections in general, so this is also another risk factor. Now, there are actually 4 different types of prostatitis, and it's important to know that because it will determine the signs and symptoms a patient is going to have. Type 1 is acute bacterial prostatitis or ABP. Type 2 is chronic bacterial prostatitis or CBP. Type 3 is chronic sterile inflammation or chronic pelvic pain syndrome or CPPS. This is actually the most common type. And then there is a 4th type known as asymptomatic inflammatory prostatitis. And as its name implies, it is an inflamed prostate without symptoms. It's asymptomatic. So we're not going to talk about this type in this lesson because there are no symptoms. The remaining 3 different types are going to have slightly different clinical presentations. So the signs and symptoms depend on the type of prostatitis. And that brings us to our sponsor, Chegg. Now, a lot of science and medical topics can be very challenging and complex to learn and remember. But with the Chegg study pack, you can learn even more about the prostate gland and the important anatomical structures of the male reproductive system, which is very important in understanding some of the pathophysiology as to how and why prostatitis occurs. Each topic is organized in a very clear way and guides you all the way from the basics of the topic through to the more advanced information. For me personally, I've used Chegg in the past during my pre-med undergraduate studies as an additional learning resource, which was definitely helpful. I have also used the Chegg study pack to further complement my studies on a variety of science and medicine topics and have found their resources very helpful. The Chegg study pack is particularly useful because it also helps improve your writing skills and your math skills as well. Not only does Chegg have a large library of their own educational resources, they also provide a variety of significant discounts on many different textbooks, which is incredibly helpful for students. Chegg also has many different practice tests and millions of flashcards to help with your studies as well. If you want to get access to this great resource, check out the link in the description below for $5 off the first month of Chegg study pack. So let's first talk about type 1 or acute bacterial prostatitis. The signs and symptoms of acute bacterial prostatitis are going to occur abruptly. This is actually an infection of the prostate gland leading to prostate inflammation. So it is an acute bacterial infection of the prostate gland leading to prostate inflammation, and it is often caused by a urinary tract infection. So because it is an acute infection, it's going to lead to a fever in these patients. So again, this is due to an acute infection, and what happens is that the body mounts a fever in response to the infection. There's also what we call malaise. Malaise is a general feeling of being unwell. This is going to be a common finding when someone is unwell or when they're sick or when they have an infection. And then patients with acute bacterial prostatitis can also experience myalgias. So myalgias are sore, achy muscles. Again, this oftentimes occurs when a patient is feeling unwell. Some other important and more specific findings with regards to acute bacterial prostatitis are the following: lower urinary tract symptoms. So oftentimes, because this is due to a urinary tract infection, we're going to see signs and symptoms of a urinary tract infection. And some of these include urinary urgency, so a feeling that you urgently need to urinate. So that is what urinary urgency is. There's also urinary frequency. So urinary frequency is feeling like you need to urinate more often. So the number of times you urinate during the day increases. And you can have many times where you're urinating, even if you have small urine volume with each urination. And then there can be dysuria. So dysuria is a burning sensation when urinating. So these can be found in acute bacterial prostatitis. And again, all of this is due to a urinary tract infection. And then we can also see pelvic pain. So pelvic pain is something that can be found in acute bacterial prostatitis as well. So those were the symptoms of type 1 prostatitis or an acute bacterial prostatitis. Now, type 2 is the chronic bacterial prostatitis. So oftentimes these patients are going to have a scenario where they may have had an acute bacterial prostatitis in the past that wasn't treated adequately or wasn't treated enough. And this can lead to a chronic bacterial prostatitis. So with these patients, they're often going to have chronic symptoms that are recurrent, so they can come and go, and they're going to be often less severe than in type 1. Because this is a chronic infection, they're not going to mount some of those more acute symptoms we talked about before, like the fever and the malaise. But they can have some of the symptoms we talked about before in a less severe form, like the pelvic pain and perhaps some of the lower urinary tract symptoms. And they're also going to have some of the following. They can also have sexual dysfunction, so they can have issues with sexual functioning. They can have issues with pain during ejaculation. So this can occur with a chronic bacterial prostatitis. And then these patients can also have issues with fertility. So they can have infertility. And again, this can be caused by chronic prostatitis as well. So if there is a case where a patient is infertile, this may be something to think about. And then we move on to type 3, which is chronic sterile inflammation or chronic pelvic pain syndrome. These cases are most often going to be caused by an anatomical structural abnormality like an enlarged prostate. So it's not going to be caused by an infection. It's oftentimes going to be caused by something that's preventing or causing reflux of urine in and around the prostate that causes inflammation of the prostate. So it's sterile. There are no microorganisms. And then oftentimes the signs and symptoms are going to be similar to type 2. So we're going to see some of those sexual dysfunction issues, the pain during ejaculation, the infertility, but they can have some extra symptoms as well. And they're going to more likely have issues with pelvic pain. Now, we talked about pelvic pain being something that can occur in type 2, but it's more likely to occur in type 3, and it's going to be more of an issue with patients who have type 3 prostatitis. So oftentimes it's going to be chronic pelvic pain. And then the pain can also involve the penis, the scrotum, and the perineal areas as well. So it's going to spread, or it's going to be more likely to cause other issues in other parts as well. And there can be some other signs and symptoms that are associated with type 3 prostatitis. And again, these are most often going to be due to the underlying cause. So we talked about one of the main underlying causes is going to be enlarged prostate or benign prostatic hyperplasia. So in this image here, this is the bladder and this is the urethra. And you can imagine that with an enlarged prostate, this is the prostate that surrounds the urethra. If it's enlarged, it's going to cause the patient to have issues getting urine out of the bladder through the urethra